Good morning, everybody. It's Dr. Galvin with another post-ER update. Filming this one from my car after my 3 night shifts in a row. For those of you new to this little broadcast, my name is Jeffrey Galvin. I'm a board-certified emergency medicine physician. I also run an executive health and functional medicine clinic in Charlotte, and I've been practicing emergency medicine for about 25 years and doing my clinic for about 10. I've been posting videos since COVID started, and we usually talk about COVID and some other things. Welcome. Worked 3 days this week, which is unusual for me. I work part-time in the ER just because I kind of still love emergency medicine. And that's really the only reason I do it. I don't have to. My clinic is successful enough that I could just do that. But it's a little bit like a drug addict, I guess. And I love the people in the emergency room. I love the people I work with. I love the patients. And it's a lot of fun. Although that joy has been sorely tested in the last year and a half. And with all the difficult things we've seen with COVID, it's been hard. Although I have to say this weekend really kind of, reinforced my own personal, why I do this. And we had a very difficult case this weekend, one night where we had a teenager who was a gunshot victim who came in very, very close to death. And my team of nurses and PAs and techs and radiology techs and respiratory therapists and air crew and everybody else came together, and my consultant surgeons, and we saved this kid's life, and he's going to go on to live because he tried very, very hard to die on us, but we didn't let it happen. And that was, that's thrilling, and that's why I do this, and why many people work in this setting do that. And so it's nice to have a victory every once in a while, and it seems like in the past year victories have been hard to come by. But hey, there's a reason that we do this, and if not for the staff of amazing people that I work with, that kid would be in a funeral home instead of being in the hospital. And so I'm proud of that. I'm proud of my staff. They did an awesome job. Real quick thing, little update. We've been talking about Omicron. Keep telling you that we're waiting for more information, and information is slowly coming in. We don't really know a lot, but what we know is that it's very contagious, and it's infecting people who have been immunized. It's been infecting people who have had COVID before. The good news is it looks like in those people, at least, they're getting mild disease. So immunization is definitely protective still against severe disease. Prior infection also seems to be protective against severe disease. We don't know about those people, the 30%, 40% of the population, depending on what state you're in, who are unimmunized. We don't know what that looks like. We do know that Omicron in England is predicted to be the top variant, meaning it's out-competing Delta, and they think in the next 2 to 4 weeks it's going to be the sort of reigning champion. And so we really need to get more information about Omicron before we can really make decisions. But it looks like we could be in for some hard times, especially if you're not immunized and you're not protected. And even those people who are immunized, it looks like boosters really do increase that immunization. If you've had 2 doses of Pfizer, and that's more than 6 months, it looks like your resistance to Omicron is very, very low. But if you get a booster, it comes up to be pretty good resistance. Let's see what else I said. It's spreading fast. We talked about the fact that 3 vaccine doses may be needed. One of the we talked about vaccines. We've still, people are in their camps. There's probably nothing I can say or do that's going to change the people who don't believe in vaccines, change their mind until somebody close to them dies or gets really, really sick. That seems to be the only thing in my circle of people that seems to change people's minds. But a couple things, post-COVID, hair loss. Now, I don't have a lot of hair, but we're seeing a lot of people who have had post-COVID and losing their hair afterwards, so there's a reason to try not to get it. The other thing is that we've talked about the link between obesity and COVID, and there's a study that shows that COVID is actually binding to fat cells and fat tissue, and that may be why people who are obese are having a harder time with COVID. And I keep promising we're going to do more about weight loss, and I'm going to do that. Just got a lot going on in my world, and so just bear with me. Anyway, that's a quick update and a quick sort of reason why I do this for the people who are wondering why I'm still working in the emergency department. And that's why everybody, please stay safe. Try not to get COVID. Do whatever you can to avoid it. My suggestion is get vaccinated, but if you're not going to get vaccinated, wear a mask. Stay away from crowds, and do everything you can to not get it. Stay safe. I'll talk to you soon. Bye.